I'm Leah. I'm 52 years old, and I am considering having a facelift, possibly some dermabrasion for up here, and a chemical peel. I'm considering having this procedure to take away some of the years and give me a more freshened look, and also to take away the frown. I'm a happy person. I'm not frowning all the time, but it sure looks like it. I'm not sure that it's going to change my feeling, as in more confidence or anything like that. I'm expecting to gain more reflect of who I really am inside, which is very, very energetic person, upbeat. I mean, they describe me at work as the ray of sunshine that just walked in. And my face looks so tired, and that's not who I am. I chose Dr. Cruz after 10 years of research, looking for doctors on the internet and setting appointments and interviewing them. And each time I'd ask them poignant questions, a lot of times they didn't really answer to my satisfaction based on the research that I had. Dr. Cruz did. That's why I chose him.
Well, what brings you here to our office?
Well, I want to have a facelift. I'm considering a facelift and chemical peel. I want to get rid of the wrinkles here and the wrinkles in here, and I want to lift this.
So you basically pointed to just about everything.
Correct. Move this face upward.
So you're telling me that you've had facial aging, okay? Right?
Yes, definitely have. It's drooped.
Okay. If you were to point it out, what is it that bothers you the most?
Well, when I put on makeup in the morning is the biggest problem.
Okay, so your upper eyes?
The eyes, and also when I put makeup on here, it gets into the creases. Okay. I have a frown look, and I'm not. I mean, I'm a pretty upbeat type of person. And here I'm looking in the mirror, and there's a frown in the mirror. Right. So I want to change that. I want to freshen my look.
You know, that's very common. People come in and they tell me that they look tired even when they don't, that their friends will say, "Are you tired?" and they're really not.
Right.
And I know that can be hard, because here you think that you're looking tired, you're looking good, and people are saying that you look tired. 10 years ago, when people thought of facelifting, what they thought of was essentially pulling on skin and just tightening the skin. But we know now that really skin excess is really just a small part of facial aging. What we need to correct is the facial fat that has fallen, and unless you do that, you're not going to get back to where you want to be as far as youthfulness.
When I put on foundation, I just don't anymore. It's a waste of time. It doesn't work for me.
Really?
The skin is not smooth enough, and so what happens is the makeup goes right into the creases.
Especially the upper lip and the eyes.
Yes, it's terrible. I mean, it actually accents my age, so it's much better just not to put foundation on and to just put the rouge and a little bit of eye accent and walk out the door.
Alright, so what I'm going to do is I'm going to put some marks on you. We're going to go over what we're going to do. With facelifting, the most pressing thing is the fact that it's so emotional.
Right, I hear that, yeah.
That's something. It's not really the pain. You're going to be fine with that. What we want to correct with you is the fact that you have aged. No big surprise. No. And what we want to do is we want to make you look more rejuvenated. Part of the aging process has been the fact that a lot of your facial structures have just fallen. And what we want to do is we're going to put them back up, but in a natural way.
Exactly.
Definitely, we're going to define your jawline. When you're done with this procedure, you're going to have a gorgeous jawline.
Okay.
It's going to be nice and triangular. Well, we're here with Leah, and we're just about ready to start with the procedure. And what we want to do is we want to give her a more vibrant, more youthful look, and that's something that we can easily accomplish. What she wants is what we do on a regular basis. Part of Leah's rejuvenation is we're going to start with the brow. We're going to elevate the brow to put that up and to give her a less tired look. In addition to that, we're going to be bringing the facial fat back up, because she's got jowling, she's got some folds above her lips that we need to correct, and she also has some excess skin too, so we're going to be removing a little bit of that. But the majority of our procedure is going to be bringing up her cheek fat and elevating her muscles back into position, giving her a nice defined chin, a nicely defined jawline, getting rid of the sagging portion of the neck, just giving her a more vibrant, youthful look. So it's been about 2 months since we started our journey. And it is a journey, isn't it?
Yes, it is. Very much so. It's quite a change.
Because I know we've gone through the surgery, then we went through the post-operative period, the healing phase, and then the getting used to the new Leah phase.
Right. It was time to start taking care of myself. And one of the things I wanted to do was to have a fresh face for work. A woman who is older and feels older will act differently and dress differently than a woman that feels younger. And that's the change. I'm a single mom, and as such, you know, we live alone in our house, and it's just us, and so we're always together, and which is a big pet peeve with her. But anyway,
she wants a little privacy.
She wants some independence. She's 15. But we really were. There's huge generational gap in our clothing and what we thought is normal, our makeup, our hair, and now that's been closed in a bit, we're sharing the same things.
Why are you more into that? Why do you apply makeup now? I mean,
well, because I can. Before I couldn't. There were the great crevices on my face, and makeup wouldn't stay, or it just landed into the creases. It was no point.
Was there a sense of futility, or?
Yeah, definitely. Why bother?
We set the clock back a little, and it's.
We not only set the clock back. Forget that. I mean, we made me prettier. I'm prettier than I was, and I'm not used to it yet.
That's what it's all about.
Yeah.
Essentially, the icing on the cake. You know, once we have structurally got her face back to the way that it was when she was younger, you know, now we have to deal with the skin, because the facelift doesn't do anything for the texture. Leah had quite a bit of sun damage. You know, she has that California skin, and the chemical peel did an amazing job, just taking that top layer off and giving her that nice, thicker, more vascular skin underneath. She has more of a glowing appearance right now, more of a youthful appearance.
I'm very, very happy with this. I would recommend this. Don't allow yourself to age like that. We don't need to anymore. We're not in the dark ages anymore. I should have done it 10 years ago. I really should have.